Thank you all for joining us today for our online health series. Today we have Renown Institute for Cancer's Breast Nurse Navigator, Bobbi Gillis, talking about the unknown signs and symptoms of breast cancer. Let me change the slide real quick. As a reminder, today's seminar is being recorded and will be available online after the presentation. If you have any questions during today's presentation, please submit them using the chat function on the left-hand side of your screen. Bobbi will be addressing your questions at the end of the presentation. And now I'd like to turn it over to Bobbi.
Hello there. How is everyone? Well, let's just get right to it. This is the signs and symptoms of breast cancer. And first, I thought I'd start with some fast facts. As you may or may not know, breast cancer is something that is very prevalent. 1 out of every 8 women will develop breast cancer during her lifetime. And it's estimated that in this year, we'll have over 200,000 new cases of breast cancer. So it is certainly something that we look for and want to make you aware of early detection methods. In addition, there's 63,000 new cases of in situ cancer. And I'll go through a little bit what in situ cancer is, but that basically is a very, very early breast cancer, which is really what we want to do, is find breast cancer when it's very early and very treatable. So again, breast cancer treatment is much more successful if started early. And when we find very early cancer, it is very, very treatable. The 5-year survival is as high as 97%. And at this time, there's over 2.5 million breast cancer survivors in the U.S. The incidence in younger women, though rare, is something that we look at a little bit more today than we used to, because we want to find out why, and we also want to make sure that women who are younger are screening more. I think that breast cancer is always thought to be a cancer of women as they age, but what we're finding is 5% of breast cancers occur in women under the age of 40. So it is something that we want younger women to be aware of, and the presentation today will go over some ways that can help. What we've found in our clinical trial research is that younger women who are diagnosed have a higher incidence of the BRCA1 and BRCA2 genetic mutation, and women who carry this gene mutation are at an increased risk for breast and ovarian cancers. So it is something we want to educate women about and something we want to encourage screening. Actually, men are not people who shouldn't ignore breast cancer. This can occur in men also. Boys and girls have amount of breast tissue. Men, of course, have a little bit less breast tissue than women. It's a rare disease, less than 1%, but it is something that if there seems to be a genetic link, something that we educate men about screening and early detection. There are basically 4 ways that I want to go over with you today how we can really help you in early detection and knowing about yourself and symptoms so that you can find a breast cancer early. The first is to know your risk, and that really is something that you need to talk with your family about and find out about their family health history. Who had what disease and at what age. Very good thing to jot down, and then when you see your healthcare provider, to share that information with him or her so that they can assess and give you your personal risk of breast cancer. It's very important. Risk factors are something you probably have heard about in the media. There's many risk factors that you can control and some risk factors that you just can't control. So I am a nurse that likes to concentrate on those things that we have some control over. The first being a high BMI or high body mass index. We found that in postmenopausal women that weight gain or obesity seems to be a risk factor in our clinical trial research. So something that, again, we can control a little bit. It also sort of goes hand in hand with lack of exercise. So in trying to keep your body mass index a little bit lower and increasing your exercise are two good, healthy things that can not only help with your risk for breast cancer, but also of many other diseases. Smoking, if you are a smoker or around someone who does smoke, it probably is worth your while to try a stop smoking program or eliminate the secondhand smoke that you're receiving. What we found in clinical data is that drinking alcohol can have a risk for breast cancer, and the clinical trial data has shown us that more than 2 drinks in a day for women is something that seems to mildly increase their risk. So just something to look at. Also to be cognizant of your risk and look at what type of extra hormones you might be ingesting, whether they be birth control pills or in postmenopausal women, postmenopausal hormone use. So just some things to talk with your doctor about when you're assessing your risk with him or her. Of course, there are some risk factors you really can't control, and one of them is aging. So as we get older, our risk does get higher for all sorts of cancers, breast cancer included. You have a little bit of a higher risk if you've had a breast cancer already, which makes some sense. And also we find in women who have very high, very dense breasts, a lot of benign breast disease, it just makes it a bit more difficult to see through that tissue. So we do recommend some additional types of screening tools for women in that situation. Family history may or may not mean that you have a genetic link, but it's something that your doctor can sit down with you and sort of analyze and look at. Breast cancer in your family, is it on your mom's side or your dad's side, and what specific type of cancers and at what age were those cancers diagnosed? Important data to kind of gather in your background. And also to look, if you are at a high risk, of genetic counseling and genetic testing for a gene mutation. The other thing we look at in breast cancer is, again, along with the thought of hormone use, if women have full-term pregnancies after the age of 30, or they tend not to breastfeed, those early, late, and starting their periods a little bit early and ending their periods a little bit late, all that hormonal history has something to do with hormonal cancers, which breast cancer is one of. We went over about your menstrual history. Of course, you can't control that, but it's just something to be aware of as you're looking at your risk factors. Race, we do find that race has something to do with breast cancers. A lot of our outreach in the community is around educating women because we have found that if we can educate about early detection and get women in for screening, we have a much better outcome. If when you were young, in your youth, you had a high radiation exposure, normally that is children who had a cancer and had to have radiation treatment or very frequent x-rays seem to have a higher risk for breast cancer as they age. And also women who have an elevated blood estrogen seem to have a higher risk. Now, what is cancer? You probably have heard many different things about cancer, but cancer is actually just caused by cells that don't know how to stop dividing. They've been altered either from a genetic mutation or some type of outside factor that's been passed down and now has started to make that process activate. And what happens is they multiply into hundreds and thousands of cells that cluster together and they form a lump or mass or a tumor. But of course, cancer doesn't appear overnight. It takes many, many years. And our hope in early detection is that we find it at such an early stage before it has grown to a point where it's a little bit more difficult to treat. That's why early detection is just so important. So what causes cancer, or breast cancer specifically? We do know in a low percent of cancers, 5 to 10%, depending on how we look at the genes, it is a genetic mutation. But the vast majority of breast cancer is actually caused by something else that we can't quite put our finger on yet. Thank goodness we have many, many clinical trials looking at this. And knowing that there are some controllable things that we can do, and as we go closer to finding a cure for breast cancer, we'll be able to enlighten you more. But as we are right now, we really want to focus on early detection and things that you can do, healthy living things, so that you can have a healthy immune system to battle a cancer if it was to develop. Here's a quick overview on how cancer affects the breast, and not to go into a lot of detail, but cancer in the breast either forms in the ducts or in the lobules, the little pockets that hold the milk in the breast. So normally we'll see those changes within the breast. There is a less common form of breast cancer called Paget's disease, which can affect the nipple in terms of a scaling kind of irritation on the nipple area or areola, and rarely also is a form of cancer called inflammatory breast cancer, which is actually a cancer that presents in the breast as a swollen, red, warm-to-touch breast that has some pain associated with it. And we'll go into that in a little bit. So step number 2 is to really know what's normal for you. And your norm is going to be something that you get used to by examining your breast frequently. There's been some change in guidelines as we've looked at clinical trial data to see what's important in terms of guidelines. And basically, we follow the American Cancer Society guidelines for breast self-exam, which say it's an option. It's something that you should start in your 20s. And it's important to know what your breasts look and feel like so that you can report a change. So if that means monthly for you, if that's a good thing to check, or if you do it less frequently, just to be sure. I do encourage women, though, that after they've had their clinical exam by a healthcare provider, they go home that night and assess their breast tissue, because that will give you a pretty clear indication of that that's a normal feel to your breast. And again, breasts are made up of, it's just one big gland, and it's made up of these little lobules and some ducts that carry the milk to the end through the nipple. It has a vast network of lymphatic system, and the lymphatic system drains into the lymph nodes, and those are just like tiny little filters that remove toxin from the breast and the surrounding area. Finding breast changes is something that can't always be felt, but it is important to kind of know your normal, and also know if you still have a monthly cycle, that to examine your breasts at the end of your cycle. I usually say wait, 5 days or so after your cycle when your hormones are kind of low and they're not so tender and full. Seems to be a good time. If you're not having periods anymore, just pick a day of the month that seems convenient. If it's the 1st or the 15th when you pay your bills, or whatever you're going to remember. And keep in mind that it's not scary, that even though you may have lots of lumps and bumps in your breast, what's important is to first know what's normal, and then you'll be able to pick an abnormality out of there. And breast cancer is something that is just out of the norm. It does not feel like normal tissue, and it usually is sort of hard and not something that you felt before. So you just want to report any abnormalities. Now, what do you alert your healthcare provider to? And I know this is a topic that probably you've heard over the years. You've seen how to examine your breast, and I am wanting to encourage you that when you do your breast self-exams, that you're looking at things a little bit differently now than you may have before. So when you examine your breast, a lot of times we were laying down and examining our breasts and then looking in the mirror and maybe examining in the shower when we're standing. And those are all good ways. Find something that's comfortable for you. What I want you to alert your healthcare provider about is any kind of lump, hard knot, or thickening inside the breast or all the way up to the armpit or axilla and all the way up to your clavicle, anything that just feels different, doesn't feel like the other side. I also want you to be aware of how your breast looks. If you look and compare both your breasts, normally your left and your right breast are not going to be exactly the same. So you kind of know that as your norm. But if you notice an abnormal swelling, a warmth to the breast in one area, a redness or darkening of the breast, that's something to take a little closer look at and alert your healthcare provider. Also of concern is a dimpling, a puckering of the skin, or sometimes in inflammatory cancer we see sort of an orange peel effect. Again, something to report right away. And looking at your breast, has one breast changed in size or shape, or does it always look that way to you? So just kind of to get those familiarities down so that you can be alerted to a change. I'd also be concerned if you have an itchy or scaly sore or rash on the nipple or a realer area. If you had a pulling in of the nipple or another part of your breast, if you had nipple discharge that started suddenly, or a new pain in just one spot that did not go away and was not something that kind of went with your cycle. So important to go to your healthcare provider on a regular basis and get that clinical breast exam. Your healthcare provider is really the best one to do that for you, and again will give you that assurance that that lumpiness or what you're feeling in your breast is okay. Always good to validate with someone who's a health expert. For women between their 20s and 30s, the American Cancer Society recommends a clinical breast exam at least every 3 years. And after the age of 40, women should have breast exams every year. And it's a really good idea to get in that habit of scheduling it, at the same time every year. It should be part of just the regular medical checkup. It's not a substitute for mammogram. It's used in combination with breast self-exam and mammography or sonostomy. And the next way that I want you to look at in terms of early detection is mammography. It really is the best way we have right now of finding very early cancers, and oftentimes cancers that we can see before you're able to feel them. The Cancer Society suggests screening mammography after the age of 40 yearly. And while mammograms can miss some cancers, and we'll go over that a little bit, it is really the best imaging tool we have right now. We've improved our mammograms so much. I'll go over that in just a little bit. At Renown Breast Health Center, we have 2 locations, one off of South McCarran and one on East 2nd Street. Very easy to schedule. We are a nationally accredited breast center through the American College of Surgeons. We're also a breast center of excellence, and our mammograms and imaging studies are read through Reno Radiological Associates. Mammograms can be used for 2 purposes. One is screening, which is what we're talking about today. That's when you have no problems. You're just going in to have a mammogram to see if there's anything in the breast that you're not able to feel or your doctor's not able to feel. That's a screening. A diagnostic mammogram is used if we know that there's a lump and we want to look closer at that area or area of concern, or if you're in your screening mammogram, we find something we want to look at a little bit closer, then you come back to the breast center for a diagnostic mammogram. And we look at our digital mammography now, and we can see breast tissue so much better than we could with our older film screen method. We are being able to image, and our radiologists are experts in reading mammograms and detecting those very early cancers. Calcifications are something that can appear in the breast for a range of reasons. The mineral calcium leaves calcifications. Macrocalcifications are a little bit larger. Those are usually kind of caused by the aging process. And microcalcifications are something that we look at and can be associated with a benign process or a cancerous process. So we look very close at calcifications, and our mammographers identify the size, the shape, the grouping of those calcifications to determine if it's something that we want to look at closer, something we'd want to biopsy, or something that's clearly a benign process. Breast MRI is another tool we use to look at breast tissue. It is a very helpful tool to examine breast tissue. It is not something right now that we use for everyday screening for most women. Some of our high-risk women, this is the tool that we use for screening. It's able to give us some very good information about the breast tissue and help us to image those areas. Dense breast tissue is always of a concern to a radiologist. We are constantly looking at ways that we can look at dense breast tissue and evaluate it better to see what might be hiding. This is a breast that is, I'm trying to pull a little arrow here. This is a breast that is fatty replaced, which does not mean that you're fat. It just means that your breast has replaced most of its breast tissue with a fatty composition versus a dense breast tissue. And we're able to see areas in the breast very well if your breast is fatty replaced. If your breast tissue is dense, it is like a snowball in a snowstorm. It is very, very difficult to see through that breast tissue with a mammogram. So those types of breasts, we call on other types of imaging to help us. One of those tools may be a sonocinase, which is an automated breast ultrasound. We provide this screening procedure in combination with mammograms, and it really helps us in early detection when it's difficult for the mammogram to see through very dense breast tissue. If you don't know if you have dense breasts or not, when you come for your mammogram next, ask your technologist if you do, and when you receive your report, that will be something that you will be able to see from your report. So you could always consider a sonocinase if you were found to have dense breast tissue. If we wanted to look closer at an area in your breast, we would direct an ultrasound to that area, and that's really helpful to tell us if that area is full of fluid, or if it's a solid tumor, or if it's just normal breast tissue. So just another tool that we use to help us to look closer at the breast. So we've talked about knowing your risk. We've talked a little bit about risk factors. We've talked about ways of early detection, breast self-exam, healthcare provider exam, and mammograms or sonocinase. Now I want to talk about a little bit more about what you can do to decrease your risk of cancer overall, and specifically breast cancer. Making healthy lifestyle choices can seem overwhelming. So I always suggest to patients that you want to just take it in little bits at a time. Work on one area in little bits before you tackle the whole thing. So certainly looking at things in your life that you might want to change, it might be a good time to start in January with some of those health lifestyle changes, or it could be a great time today to just pick one of these areas that you may want to work on. One is to maintain a healthy weight. Well, that's probably easier said than done in most of our lives, but to look closer at your body mass index and trying to decrease that, because in some ways you can not only be helping with reducing your risk of cancer, but also many other chronic diseases like diabetes and heart disease. Adding exercise to your routine doesn't mean that you have to go out and spend a lot of money on expensive equipment. You can just start a walking program, but getting something into your day where you are elevating your heart rate and exercise is very good for you. Limiting your alcohol intake, probably anything in moderation is probably a better bet than in excess. Limiting postmenopausal hormone use. Breastfeeding if you can for at least 6 months. And if you have the choice of making a decision, giving birth before your mid-30s. Reducing your risk. Of course, we always want to encourage people not to smoke and avoid secondhand smoke. And I know that this is a very difficult thing to do, is to stop smoking. So we have lots of resources at Renown to help with that. Exercise regularly. The last clinical study that I looked at every 30 minutes, 4 times a week. So I just tell patients, try to just work it into your daily schedule. Just a little bit of exercise every day is really going to benefit you. Eat a variety of colorful fruits and vegetables every day. And by colorful, I mean don't always eat things that are red, or only things that are yellow, or only things that are green. Try to mix it up every day so that you've got a good variety, because I'll show you in a little bit that variety has different vitamins and minerals that can be doing good things for you. Make sure that you've got plenty of calcium. That will help overall with osteoporosis, but can help with many other chronic disease entities. And look to see what your vitamin D is at, and ask your healthcare provider about a vitamin D supplement. More research is needed in this area, but it is something we're looking at pretty close. Nutrogenomics is basically you are what you eat. And what you eat interacts with what's inside of your body, in your genes, and it can influence your health. So what research tells us is that eating good foods, fruits and vegetables, can decrease your risk of cancer. And though there may be not many clinical trials in this area, it is something that we found from the very few clinical trials that we've seen. So it is something that I think women and men can kind of grab onto and do in terms of healthy lifestyle changes. Your genetic makeup will certainly make a difference in how your body uses those nutrients, but giving your body those nutrients is well worth the while. From research, we found different things in terms of how you should eat during a day. I listed some of those from the different trials that I looked at. Again, there's that fruits and vegetables every day, colorful ones. 8 to 10 servings seems kind of high, I'm sure. But remember, a serving, if you would take your fist now and just make a fist that size, is a serving. So I'll bet when you have a salad, you could have almost 2 to 3 servings of lettuce if you had a good-sized salad. Upping your fiber, and that's not fiber that's processed, but fiber that's more whole grain. Limiting the amount of processed grains and sugars. Healthy fats versus unhealthy fats. Flaxseed there's 2 or 3 trials that I looked at that recommended flaxseed as a good alternative to adding to your foods. Green tea, 1 to 4 cups daily. We talked a little bit about vitamin D already. Soy products seem to have a protective factor in some cancers, but certainly in other cancers we try to not have women overdo, so just something to look at. And again, limiting your alcohol intake. The Healthy Plate came out a couple years ago. It's kind of different than the pyramid that we looked at 10, 20 years ago, and we're looking at basically just a higher serving of fruits and vegetables, lean protein than dairy. It's important to have low-fat dairy, lean foods instead of a lot of red meats, and again, carbohydrates being whole grain. Here's that photochemicals again, the protective components in the foods we eat. The more foods that you can get from the dirt versus foods that are processed, the better in terms of getting your nutrients. And if alcohol is okay, if it's red wine, right? You've heard a lot that red wine has a cardioprotective benefit. So many people thought that that was okay to get a lot of that benefit in every day, but what we found in clinical trials is that 3 to 4 drinks in a week can actually increase your chance of reoccurrence. So it is something we look at in terms of hormones. You can get some higher estrogen levels with alcohol, so we really try to encourage women to moderate their alcohol intake. Here's that daily physical activity again. We found that it does help in lowering risk, though it's not a huge thing in terms of clinical trial data. It is something that you can do and something that's kind of fun to get out and be active.
Perfect. Well, we thank you, Bobbi, for all the great information. We have just a few minutes left in our program today. If you have questions about today's presentation, please submit them using the chat function on the left-hand side of your screen, and Bobbi will be happy to address them. So I've got a couple questions coming in right now. Can MRI detect DCIS? And I would like you to explain what DCIS is.
Absolutely. DCIS is a very, very early cancer, a ductal carcinoma in situ. And usually the easiest way for us to see a DCIS would not be as a lump or a bump in the breast, but it is something that we see on your screening mammogram, because DCIS tends to leave little calcification, little calcium deposits in the breast, and usually they are the size and shape and groupings of something that the radiologist will pick up and want to biopsy. MRI is helpful in locating different areas, looking at the full breast and also the opposite breast to look at DCIS, but really mammograms are the #1 way that we find DCIS in the breast. So anytime we screen with MRI, if we can, we also like to use that in combination with mammography.
As well. Okay, good answer. For women with breast implants, is there a different procedure or a different way that you would go about doing the breast self-examination, or are they looked at differently?
We are able to screen the breast that has an implant in it very easily. We are aware that any kind of compression to the breast can cause the implant to rupture. So we just make sure that you know prior to your mammogram that it is a possibility, and then how we position and how we compress with that type of patient is a little bit different than we normally would, but certainly we're able to screen the breast tissue very well.
Okay. And they would do the same self-examination as any other person?
We sure do.
Okay.
Most of the time the implant is put behind the pectoral muscle, and so it goes muscle and then implant, and then your breast tissue is out to the location so that you're able to screen with breast self-exam.
Okay. Do you have any favorite website resources? I know you mentioned the American Cancer Society. Do you have any other favorite websites that you like to go to for cancer information?
I think there's a lot. If I Google breast cancer, you will come up with pages and pages of opportunities to look at, and certainly there's many, many websites out there. What I've found in terms of risk factors and early detection is the Susan G. Komen for the Cure website is very good in identifying risk factors and looking at early detection. They have a very good website in putting those together. When we look at breast cancer treatment, information about the different types of treatment and chemotherapy. Specifically, the American Cancer Society really does a great job with helping to identify and explain a lot of the different types of surgeries, radiation, and chemotherapy. And there are many web resources out there for survivors. And certainly if you have more questions, you can feel free to give us a call, and I can put you in contact with those web resources.
Perfect, perfect. So, we have another question coming in. We'll grab this one real quick and then we'll finish up. When should the daughters of women who had an early breast cancer diagnosis get their first mammogram?
Usually we look at, whenever the woman gets the diagnosis, we look at about 10 years prior to that age to when her daughters would begin screening. So for example, if you developed a breast cancer at the age of 38, your daughter would begin screening at the age of 28. But it is something that you want to sit down with your doctor and talk a little bit more about, and when your daughter gets to the age where she can start seeing your physician, maybe the three of you discussing her risk factors and how she should be screening now. Because of course she still could be doing her breast self-exam and more frequent healthcare provider exams.
Perfect. Great answer. Well, this concludes our online health series on the unknown signs and symptoms of breast cancer. Thank you for joining us today. To learn more about Renown Health Breast Center, please visit us online at renown.org/breasthealth. To view a recording of today's presentation or to view the schedule for upcoming events, visit us at renown.org online health series. Is there a specific health topic you'd like to learn more about? Let us know by completing the post-seminar survey. And as always, we wish you continued health. Thank you, Bobbi.
Thank you.